If you feel stuck in a cycle of unsatisfying or painful relationships, you are not alone. In fact, what if I told you that up to 40% of adults are insecurely attached? A secure connection style is actually in the minority. This isn't just about romance. It's deeply tied to anxiety, depression, and a constant feeling of not being good enough. Left unaddressed, these patterns can create chronic stress, deep loneliness, and profound emotional isolation. But there is a clear path to healing. We will identify the patterns, understand their origins, and show the proven therapies that lead to a secure life. So, what do these insecure patterns actually look like? It starts by understanding the three main types: anxious, avoidant, and disorganized. The anxious type often fears abandonment and seeks constant reassurance. This pattern stems from inconsistent care in childhood. The avoidant type values independence above all, often suppressing emotions and distancing themselves when others get too close. The disorganized type experiences a confusing mix of both. They crave closeness but are terrified of it, often due to a history of trauma. And these styles don't just affect your love life. They shape your friendships, your career dynamics, and even how you talk to yourself. These patterns feel so ingrained, so automatic. But why do early experiences have such a powerful, lasting grip on our biology? The answer lies in our brain's wiring. Insecure attachment is not just a psychological concept. It has measurable effects on our neural pathways. It impacts structures like the amygdala, our brain's fear center, making it overreactive. This is why a simple text can trigger panic or an urge to shut down. But the brain is only half the story. Our bodies also keep the score. Attachment trauma isn't just a memory, it's a physical imprint in our nervous system. This is why talk therapy alone sometimes isn't enough. Somatic therapies work to release this stored tension, helping the body learn that it is safe now. Understanding this mind-body connection is the key that explains why modern therapy is so effective. It's about healing both thoughts and feelings in the body. Now that we know the why, let's look at the how. How do these deep-seated patterns show up in daily life, often in surprising ways? Take the common myth about the avoidant individual, that they don't want love. The reality is they often crave deep connection, but fear intimacy will engulf them. For the anxious type, healing isn't about finding the perfect partner. It's the counterintuitive practice of learning to sit with discomfort and self-soothe. And the disorganized type lives this conflict externally, with a push-pull dynamic. They pull you close, then abruptly push you away when vulnerability feels too scary. Remember that 40% statistic? The reality might be even more staggering. The number is likely higher because many avoidant individuals test as secure on surveys. This all might sound bleak, but here is the most important myth to bust. Your attachment style is not a life sentence. Your brain can absolutely change. Through new experiences and therapy, you can develop earned secure attachment. You can consciously build the security you may not have received. So if our patterns are deeply wired but changeable, what does that change process actually look like? This is where targeted therapy programs come in. The foundation of many effective therapies is creating a safe, consistent therapeutic relationship. This bond itself becomes a corrective emotional experience. Remember how anxious attachment stems from inconsistent care? The consistency and safety of therapy directly repairs that original wound. One powerful technique is reparenting the inner child. A therapist helps you give your younger self the compassion and understanding that we're missing. Models like emotionally focused therapy, or EFT, are built entirely around this idea, reframing relationship conflict through the lens of attachment needs. Other approaches like CBT help challenge negative core beliefs, while EMDR helps process the specific traumatic memories that wire these patterns into the brain. Notice how these therapies are a direct answer to the problem. They work on the brain's wiring, the body's stored trauma, and the emotional patterns all at once. So let's bring this all together. Insecure attachment is widespread, biologically rooted, and has serious consequences, but it is not a permanent state. We now have a deep understanding of how to identify these patterns and, more importantly, how to effectively treat them. Healing is a predictable outcome. The goal is not to erase your past, but to build a present where you feel safe, connected, and whole. This is the promise of earned secure attachment. If any of this connected with you, the first step is curiosity. Learn about your own patterns and consider reaching out to an attachment-informed therapist. You deserve relationships that feel like a safe harbor, not a battlefield. If this video was helpful, share it with someone who might need this message.